Today is National HIV Testing Day, and several health centers across South Carolina are offering free tests to make sure you know your status.
Our Georgia Godfrey tells us why testing is especially important in South Carolina, where we are seeing an increase in risk factors for the disease.
For the aggregate years of 2016-17, South Carolina ranks number 5 for HIV.
In that two-year period, 2016 and 2017, 1,520 people were diagnosed with HIV in the state, a slight increase from the 2 years prior.
The South, in general, has a higher population of individuals or frequency of individuals who are positive.
That is why the state's effort to encourage residents to get tested is so important.
Knowing your status can empower you to seek medical care, to end up with a better quality of health and life.
According to the Department of Health and Environmental Control, men who have sex with men represent the largest proportion of newly diagnosed cases in the state. A small percentage of the cases were from injecting drug use, a risk factor health officials now have to consider in the opioid crisis.
Heroin is an illegal opioid, and worse yet, it is one that can only be injected with IV drug use. So that brings in to this whole opioid crisis the fact that infectious diseases became a big part of this. Think of hepatitis C, think of HIV. Now all of a sudden, by heroin being used and used in such a quick manner, it increased fourfold since 2010, that now we know clusters of hepatitis C and HIV were back on the rise.
And because of this correlation, the state is working with recovery programs to get those patients connected with the appropriate treatments. DHEC will also be working with the CDC to find an intersection between the opioid use and HIV. In Columbia, Georgia Godfrey, 7 News.
The most recent numbers are from 2017, where Williamsburg County ranked number 1 in the state for newly diagnosed cases per 100,000 people. There were 11 cases that year. Lee County following with 6. And for perspective, that county only has 17,000 people.